Recent legislation is reshaping the healthcare landscape for millions of Americans. The One Big Beautiful Bill introduces sweeping changes to Medicare and Medicaid that could significantly impact your coverage and financial security. These modifications may affect your eligibility, increase your out-of-pocket costs, and reduce access to essential services. If you're a senior with lawful immigration status who paid into Medicare but aren't a U.S. citizen or permanent resident, you may lose your coverage entirely. This sharp policy shift breaks from the long-standing rule that anyone who contributed to Medicare through payroll taxes would qualify for benefits. In addition to losing Medicare, you may also lose access to Affordable Care Act subsidies, leaving you with limited coverage options after years of contributing. Low-income seniors will also see major setbacks. The bill rolls back enhancements to Medicare savings programs and the Part D low-income subsidy. About 1.4 million people will lose this assistance, forcing many to pay Medicare premiums and copays out of pocket. The Part B premium alone will cost $185 per month in 2025 and is expected to rise to over $4,000 per year by 2034. If you and your spouse have a combined income of $21,000, your healthcare expenses could increase by over $8,000 next year, consuming much of your Social Security income. Medicare funding will take another hit due to automatic cuts triggered by the bill's deficit-increasing tax provisions. Unless Congress intervenes, roughly $500 billion will be cut from Medicare between 2026 and 2034. This will likely reduce the benefits and services you currently receive. The Medicare Hospital Insurance Trust Fund is now expected to reach insolvency in mid-2032, 1 year earlier than previously projected. Once that happens, the program may only be able to cover 89% of its hospital benefit obligations. Medicaid faces even more dramatic reductions. Federal funding is being slashed by about $1 trillion over the next decade. New work reporting rules will lead to millions losing coverage, even if they are working or exempt, simply for failing to meet paperwork requirements. Increased out-of-pocket costs, tighter eligibility, and more frequent income checks will make it harder for you to stay enrolled. Even if you're not on Medicaid, these cuts will impact your care. Hospitals and clinics will face increased financial pressure from surges in uninsured patients, especially in rural areas. Nearly 2 million people could lose their primary care doctor, 1.3 million would forgo necessary medications, and nearly 380,000 women would miss important screenings. If you have any questions or need further assistance, you should contact a licensed agent who can explain how the One Big Beautiful Bill may affect you. For more information about Medicare, please call 866-633-4427 to reach a Senior Healthcare Solutions Medicare expert. Thanks for watching. Like and subscribe for more videos.